This is our large animal CT, which is a very exciting piece of technology, kind of similar to the small animal CT we saw over there. This is a gantry with an X-ray tube moving at high speed, imaging over 160 slices. But the big difference here is that this gantry is mounted on a double platform, and so the whole gantry, the whole machine here is going to move. So classically, you have to move the patient through the gantry to be imaged, but the design here is that the patient doesn't have to move and the machine itself moves. It also goes up and down with many different applications. First, if we move this machine up, it can come up with the base up to that level, and so it allows to raise about 2 or 3 feet from where it is right now, and we can image standing heads. So just having the horse standing in front and having the machine move. So imaging standing head on a CT takes like 10 seconds. It's easier than taking a radiograph, so that's very exciting. Then what the machine can do is drop down lower, and when the table comes lower, we can extend the limb of the horse through that table, and then the machine will move through the limb, imaging the distal aspect of the limb standing. And then the last position is to drop the machine further down with that table coming to floor level. And so that's what we do with anesthetized patients. And so we have a rail over here, so we can manipulate the horse, position it in there. The number one application is going to be for neck imaging, so cervical myogram. So that machine will move back, table at floor level, position the neck in this direction, and then the machine will come over the horse and move away while getting imaging. So we can do the neck, but then if we flip the horse around, what's super exciting, because we used to only be able to image the level of the hocks, but now if we bring the back end of the horse through the machine, we can image the stifles, we can image the pelvis, we can image along the spine. Pretty much we have a 90 centimeter diameter, so we can fit the back end of the horse through that, and so we can pretty much image the whole horse now, which is like pretty revolutionary, because we used to only be able to do the head and the distal limbs. So that's for the horses, which are going to be the main patients we get in there. But this is also super convenient for all sorts of other species. So far we've done a goat, we've done a pig, we've done a llama, and very easy, accessible. We can just do the goats, pigs, llama. We've done this under sedation by lowering the table. You have them laying on the table and moving the machine.